My name is Cheelo Mwiinga. I'm a pediatrician and a PhD fellow. I'm looking at the impact of prolonged respiratory viral infections in children living with HIV on post-discharge mortality. Respiratory viral infections are a problem in children, especially infants. So you've got respiratory syncytial virus, you've got influenza, parainfluenza virus, and adenoviruses. Those generally are those that cause concern to people looking after children like myself. But the most common is actually respiratory syncytial virus, or RSV. But even though it's the most common, it's actually the one with the least data in terms of how it affects mortality and morbidity in children living with HIV. And for me, that's a concern, because if you're in a low and middle income country, the data will definitely detect where the money goes in terms of research and hospital care for children. Generally, respiratory viruses cause acute infections in children, but sometimes they tend to have certain complications. But that's based on one's age, one's immunity, how severe the initial infection was, and also how long the infection is there for. So some of the complications will include things like it affects the pulmonary function, it causes pulmonary fibrosis. Some children can have chronic obstructive pulmonary disease. Others then tend to be more susceptible to wheezing episodes, and others will have other superimposed infections. So those are some of the complications. And what you need to do is to prevent the acute infection in the first place, because that's what you want to do. So part of the strategies would be making sure that you treat the acute infections quickly to prevent those chronic complications. You need to, unfortunately, things like immunity play a role. Things like nutrition play a role. So that's basically what I am looking at. But there are other components within the research that I'll be looking at closely.